I don't think I will take 2 hours to talk about valvular heart disease, and also 2 hours to talk about heart failure. Probably we will discuss on how we can shorten the session this morning, inshallah. Uh, but the most important thing is for you to refer to my notes and try to understand it while I'm talking, while I'm explaining. Okay, inshallah. Bismillahirrahmanirrahim. The first topic for today is valvular heart disease. The topic is follows the previous topic, which is rheumatic heart disease. Yeah, because it is one of the main causes of valvular heart disease. What is uh, valvular heart disease? It is when the valve in one or more of the valves in the heart uh, gets inflamed. There is an inflammation. It gets inflamed. One of two can happen. Number one, it can be inflamed and eventually damaged, yeah, and it crumples up, rosak, okay. And when it crumples up and it gets damaged and distorted, blood will then flow back where it came from, okay. Then this is called regurgitation, okay. It's like a door that is supposed to close, but when the door is damaged, it cannot close properly. So mm, uh, whatever it is goes to the opposite direction, okay. This is called regurgitation. Sometimes the inflammation heals, and when it heals, it starts to stick to each other, yeah, melekat, stick to each other, yeah, especially at the sides. When it sticks to each other, it forms scar tissue. Then the valve uh, becomes smaller, okay, because the sides uh, stick to each other. So the center of the valve becomes narrower and narrower, and this condition is called stenosis. Okay, so a valve gets damaged basically by inflammation, and depends on how it heals. One, it gets damaged, then it becomes regurgitation. It sticks to each other and it becomes stenosis. Both of these conditions causes a consequence, which uh, makes the flow of the blood in the heart not laminar, not no longer smooth. Okay, there is turbulence of blood. Okay, the blood flow in the heart gets turbulent. When the turbulence happens at the valves, it will cause further damage to the valve, and eventually the valve becomes destroyed. Okay, so the process of stenosis and regurgitation is initiated by inflammation. Yeah, what is the cause of inflammation? The commonest cause of inflammation and initial damage to the valve is usually rheumatic fever. Rheumatic fever happens very early in life. It happens between the age of 5 to 15. Yeah, it starts with fever, joint pains, and you know the uh, uh, due, sorry, the criteria, major and minor criteria. which has been discussed in previous topic, yeah, in valvular heart disease. It's called the Duckett-Jones criteria. Okay, not the Dukes, but the Jones criteria. Yeah.
Apa kita aku tekan something.
Sorry.
Prof.
Hello, what's happening?
Prof, I think it got disconnected just now.
Okay, let's restart again.
Prof.
Hello. Can you hear me now?
Yes, Prof, we can hear you. Hello, Prof.
Okay. I'm using my phone now. Um, something
I can share the slides for you.
connection, yeah.
I can share the slides for you.
Sorry, can you hear me now?
Yes, yes, yes.
Okay. Right. We'll not waste time. And okay. Mm, okay. So if we look back at the main cause of valvular heart disease, we will see that the main cause of valvular heart disease, either it becomes stenosis or regurgitation. The main cause is rheumatic heart disease, yeah. But there are also other causes of valvular heart disease. In the elderly, the valve can become degenerated and becomes regurgitant from ischemic heart disease. In specifically in patients in persons who have who are intravenous drug users, yeah, drug addicts, okay, who inject themselves with drugs. They can inject Staphylococcus aureus or any germs from their skin into their blood circulation, and the bacteria will go directly through the veins, and then the first place that they land in the heart is the tricuspid valve. Yeah, they can enter through the superior or inferior vena cava. Then they will end up in the heart, and the first valve that they land is the tricuspid valve. This is different than the valvular heart disease caused by the rheumatic heart disease. In rheumatic heart disease, the main valves that are involved are the valves on the left side of the heart, which is the mitral valve and the aortic valve. Okay, so this is the difference between valvular heart disease caused by uh, 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 rheumatic fever, rheumatic heart disease, chronic rheumatic heart disease, and the valvular heart disease caused by intravenous drug usage. Okay.
Prof,
Yes.
should I share the slides with you? Because
I'm trying to do it on my computer, but it says leaving or something like that. I'm leaving, and I cannot join the group back again. Then can you try share then? Okay.
sure, yes.
Prof,
Yeah.
I want to ask, how about the uh, old people? Where does the valve usually affected?
Okay, in those who have ischemic heart disease, when you have ischemia on the muscles of the heart, then the ischemia might affect the papillary muscles, okay? Because papillary muscle is part of the myocardium. So when you have papillary muscle, which actually holds the mitral valve, the papillary muscles get uh, uh, infarcted and necrosed. The papillary muscle can be elongated, ya, jadi panjang. Then it will cause the mitral valve to be abnormal, and it can cause mitral regurgitation. Okay, so if you find valvular heart disease in the elderly or patients who have ischemic heart disease, usually the valve that is involved is the mitral valve. Okay, and it causes mitral regurgitation. Okay, so what do we want to know about valvular heart disease? Okay, when someone gets a valvular heart disease, there is turbulence of blood in the heart. Okay, now the problem is blood goes to the wrong direction, or the chambers of the heart in stenosed valve needs to pump harder. Okay, needs to pump harder because the blood needs to squeeze through the stenosed valve. Dah sempit, okay? So, uh, 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 the chambers of the heart, the ventricles or the atrium, works extra hard because the blood is going everywhere, all the wrong way, okay? So, for every valve that is damaged, there are consequences to the chambers of the heart. Okay, so let's go to the uh, uh, table where you can see each and every valve disease. Okay, first you open up the table that shows mitral regurgitation. Okay, so this is the first table that will describe uh, about valvular heart disease, and you can learn everything from this table. Okay, mitral regurgitation, what happens is that the mitral valve becomes damaged, and then blood will flow from the ventricle, which is supposed to pump blood into the aorta. Then, because the valve is regurgitated, blood flows back into the left atrium. Okay, so the left ventricle now needs to work extra hard. There will be hemodynamics consequences because of this. The left ventricle will then become hypertrophied and dilated. There will be damage to the left ventricle, okay? Because it's working too hard. So it will be dilated and it will be hypertrophied, okay? Then what happens? The blood that is regurgitating back into the left atrium causes the left atrium also to have high pressure. Then the left atrium will also be dilated and hypertrophied. Okay, so you will see in the next column, left ventricle hypertrophy and dilatation, right atrial dilatation. Then the back pressure goes into the pulmonary circulation. It will cause pulmonary hypertension. Okay, then it will, the back pressure goes to the right heart. There will be right ventricular hypertrophy, right ventricular dilatation. There will be tricuspid regurgitation. There will be blood, the pressure will go up. It will cause the jugular venous pressure to be increased. So there will be JVP, there will be JVP increase. There will be elevated JVP, and through the inferior vena cava, it will go down. The pressure will cause the liver to be also enlarged. Okay, there will be hepatomegaly, and there will be ascites, and there will be edema. So mitral regurgitation is a very bad disease to have. Yeah. So you will have damage to the left ventricle, left atrium, pulmonary hypertension. The right ventricle will be dilated and hypertrophied. It will cause the tricuspid valve to be regurgitant also. It will cause right atrium to be dilated and hypertrophied. It will cause an increase in the jugular venous pressure. It will cause downwards to cause hepatomegaly, ascites, and edema. Okay. Okay. So this is the story of mitral regurgitation. The details you can read and revise in the notes. Okay. The diagram is explains it quite well. So the next we want to discuss is mitral stenosis. Mitral stenosis is the mitral valve becomes narrow and blood cannot pass through fully from the left atrium into the left ventricle. Okay. So now, because blood uh, goes into the ventricle in small amounts, the difference between stenosis and regurgitation is that in mitral stenosis, the left ventricle is not damaged. Okay. You must remember this. Okay. The left ventricle is not damaged. The left ventricle hardly needs to do a lot of work because there is very much less blood going into the left ventricle because the mitral valve is stenosed. But the backward effects, like what we saw in mitral regurgitation, the left atrium will be dilated, the left atrium will be hypertrophied, there will be atrial fibrillation because of this. Then there will be pulmonary hypertension, there will be right heart failure, right ventricular hypertrophy, tricuspid regurgitation, right atrial hypertrophy. Then there will be increase in JVP, there will be hepatomegaly, ascites, and edema. The same that happens in mitral regurgitation, except in mitral stenosis, the left ventricle is spared. Okay. So you need to know this. Okay. Okay. Next is what happens when you have aortic regurgitation. Okay. What happens when you have aortic regurgitation? What happens when you have aortic regurgitation? Blood that is pumped by the left ventricle out into the aorta then comes back into the left ventricle because the valve is regurgitant. Okay. So the left ventricle is now overburdened. The left ventricle now is overburdened, and the left ventricle have to do twice the work. It pumps blood out, and then blood goes back into the left ventricle. Okay. So what happens now? The main problem will be the left ventricle will be dilated, the left ventricle will be hypertrophied, and you will have heart failure also. Okay. But because the mitral valve in this condition is working well, you don't have all the consequences that we discussed just now. Okay. The left atrium is protected. There will not be uh, pulmonary hypertension. There will not be right heart failure. The only problem is the left ventricle. Okay. So in aortic regurgitation, the problem, the hemodynamic problem will be basically left ventricular hypertrophy and dilatation. Okay. So the rest of the heart is saved. Okay. There's no reason for you to have JVP increase. There's no reason for you to have hepatomegaly, ascites, and edema. Okay. The same happens. The same thing happens when there is my aortic stenosis. Okay. What happens in aortic stenosis? The left ventricle have to work harder to pump blood outside the heart. Okay. The left ventricle is hypertrophied and dilated. Okay. And then eventually you will have left ventricular failure. But the rest of the heart is protected because the mitral valve is functioning well. It protects the left atrium. It will protect the pulmonary system. No pulmonary hypertension, no right heart failure, no increase in JVP, no hepatomegaly, no ascites, and no edema. Okay. So these are the 4 conditions that is important for you to know in the left side of the heart, which involves the mitral and aortic valve. Okay. And what causes this problem? Mainly chronic rheumatic heart disease. The process of chronic rheumatic heart disease causes inflammation either on the mitral valve or the aortic valve, and eventually it either becomes stenosis or regurgitant. Okay. It can also happen in patients with IHD, and in patients with IHD, they will have microregurgitation. Okay. Especially in the elderly. Okay. So let's uh, let's now discuss about a special condition where there is a special type where there is someone who damages the heart by purpose, on purpose, by taking intravenous drugs. Okay. When they inject intravenous drugs, they also inject it unhygienically and inject the in this condition. This condition is called infective endocarditis. So Staphylococcus will travel through the venous system and land on the tricuspid valve and damages the tricuspid valve and causes tricuspid regurgitation. So you will see this type of patients with fever, with signs of infective endocarditis, and also tricuspid regurgitation. Okay, you have to know this condition. Okay, are we okay now?
Yes.
Okay, okay, good. Okay, I'm sorry, I'm still struggling with my computer. Okay, so a special type of special type of valve disease is special for IV drug user. We call it IVDU. And it is tricuspid regurgitation. Okay. Okay. So okay. So let's talk about let's talk valvular heart disease in general. Okay. So what happens when you get valvular heart disease? Because the turbulence of blood in the valve, patients who initially do not get infective endocarditis, patients who are not IV drug user, unfortunately, if they have a procedure like they have a tooth extraction, cabut gigi, they have a small or minor operation, they get pregnant and deliver a baby, when there is a procedure that involves blood, this procedure can cause germs or bacteria to enter the circulation. Okay, when bacteria enters the circulation and they go to the heart, and because there is turbulence of blood, then the bacteria can land on the valve and cause further damage. This condition is called infective endocarditis. Okay, I think you have discussed this before. Okay, so what do we do treatment wise? Number one, we need to give peri-procedural antibiotics. Okay, in patients who already got valvular heart disease, if they want to get their tooth extracted, they will then they will then need to be on antibiotics before their tooth extraction, during the tooth extraction, and after the tooth extraction. Okay, this is called peri-procedural antibiotics, and this is to prevent. It is to prevent infective endocarditis. Okay. Okay. So what else do we do? Patients with valvular heart disease, we need to treat the valvular heart disease. What do we do? Because it is a mechanical problem, the valve is already damaged, we need to do a surgical procedure, okay? We need to treat it with surgery, okay? There is no tablet or injection or anything that can reverse a valve disease. Cannot change a regurgitant or stenotic valve just by giving medication, okay? We need a surgical operation to either repair the damaged valve or to to replace. So what do we do to open heart surgery to repair the valve or to replace the damaged valve?
Okay, so now the treatment of valvular heart disease is surgical. Okay. Okay, Jonathan, can you move on to the next page? Okay. I also included a condition called pulmonary stenosis and regurgitation. Okay. I don't want you to concentrate too much on this condition because it is uncommon. Okay. Inshallah, we will not ask this in examination. This is just for your reading. Okay. Okay, can you move to the next page, please? Okay, let me try to. Jonathan, can you remove uh, your desktop? I will try to now upload mine.
Okay, bro.
Okay, take your time. Try to digest what I have mentioned. Yeah. Okay, very good. Now. Okay.
Now
Can you see my desktop?
Yes.
Yes, bro.
Okay,
Now I summarize what we discussed.
yeah, so
So
basically,
basically, valvular heart disease is caused by chronic inflammation of the heart valve, leading to either stenosis or regurgitation. So I said most common cause of valve damage is chronic rheumatic heart disease as a sequelae or consequence of rheumatic fever at the younger age. In patients who inject intravenous drug, they can spread the heart through the heart and cause tricuspid endocarditis. Okay? Usually causing tricuspid regurgitation. Okay? Patients who have ischemic heart disease, number 3, can also have papillary muscle dysfunction and dilatation of the mitral vein, leading to mitral regurgitation. So, patients who have mitral regurgitation they can have a lot of consequences. Number 1, they can have left ventricular hypertrophy and dilatation, left atrial dilatation, and cause atrial fibrillation, and they will have pulmonary hypertension, pulmonary regurgitation, right ventricular hypertrophy and dilatation, tricuspid regurgitation, raised JVP, hepatomegaly, ascites, and edema. Okay. Patients who have mitral stenosis can have all that, but remember their left ventricle is normal. You must remember this, and this is the main difference between mitral stenosis and regurgitation. Okay, the next what I mentioned was in patient who has aortic regurgitation, they can have left ventricular hypertrophy and dilatation, but the rest of the heart is saved by the mitral valve. Okay, the mitral valve protects the rest of the heart. It is the left ventricle that is severely damaged in aortic regurgitation. The same condition happens in aortic stenosis. Okay. In patients who are intravenous drug user, they can have tricuspid regurgitation, they can have raised JVP, hepatomegaly, ascites, and edema. Okay. So all the valvular heart disease may predispose to infective endocarditis. So we need to have peri-procedural antibiotic prophylaxis. Okay. So remember, this page is not in your notes. I have just written it for the purpose of this lecture. If you want it, I can give it to you. But if you have already written the notes, well, you don't need it anymore. Okay. Okay, let's go through the diagram again. So what happens when you have a mitral valve disease? Mitral regurgitation, you will see that the blood flows back into the left atrium, so it will cause the left atrium will be hypertrophied and dilated, the left atrium will be damaged, the right atrium, the right ventricle, all the consequence of hemodynamic consequences. Yeah. Okay, so now what will happen? You will have turbulence of blood, and this turbulence of blood will cause a murmur. Okay, murmur is the sound of turbulence. When you put your stethoscope on the chest, you will hear bzz, 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 all this yeah. So the murmur is called pansystolic murmur, and this is for mitral regurgitation. Okay. Also, you will have in mitral stenosis a mid diastolic murmur. Then you will have in aortic regurgitation early diastolic murmur. Okay. These are all important murmurs that will be asked in your clinical years when you come to clinical years. Okay. How do you learn about murmurs? You can go to YouTube and just type mitral regurgitation murmur. You will be able to listen to the murmur. Okay. It is very well demonstrated on YouTube. Okay. Okay. So the same story goes for aortic regurgitation. There is regurgitation of blood into the ventricle, and the left ventricle is damaged. There will be murmur also. Uh, uh, Different murmurs for different uh, valve disease. Okay. Okay. So that's about it for the valvular heart disease, and I think uh, I just want to show you uh, uh, a video. If you are able to open this up, I got this from YouTube also.
Prof, is there sound? Because we can't hear anything.
Oh, I can hear. I don't know.
Prof, you actually have to share the sound also.
Okay, let's try. I don't know how to share the sound.
Go to share screen again. You have to unshare the screen and share again.
Oh,
You unshare the screen, and then you see a small square on the left side that says share system audio.
okay, never mind. Forget. Okay, can you on here now?
Still no sound, bro.
Okay, okay, it's okay. All right. Okay, so now I think I can share the video later, but you can also look it up at the YouTube and you can do it at your own free time. Okay, so that is about the end of the first session. Can I open to whatever questions?
Yeah, Prof.
Yes.
Okay, so in mitral regurgitation, right, there is less blood in the left ventricle. So the left ventricle dilates and hypertrophies in response to low circulation in the systemic circulation, is it?
Hang on, in mitral regurgitation, the left ventricle is overfilled. Okay, it is not less uh, blood in the left ventricle. Only in mitral stenosis there is less blood in the left ventricle. Okay, do you get me?
Okay, all right, Prof.
So in mitral stenosis, the mitral valve is small, it's stenosed. So blood from the left atrium cannot all move into the left ventricle. Okay, so the left ventricle is underfilled. So the left ventricle got no reason to be hypertrophied or overburdened. Okay, but in mitral regurgitation, it is overfilled because some of the blood that is supposed to go to the aorta regurgitates back to the left atrium. So the left ventricle is overburdened because it has got to do double the work. Okay, so that is the major difference between mitral regurgitation and stenosis. You have to know this because I'm going to ask in the exam. Okay, any more questions?
Prof, I have a question.
Yeah.
For mitral stenosis, I don't really understand how it causes a right atrium dilatation.
Okay, so the same process of hemodynamic back pressure or backflow happens in mitral stenosis and mitral regurgitation because the left atrium cannot pump blood into the left ventricle. There is high pressure in the left atrium. It's overburdened because it cannot pump blood into the left ventricle well. So because there is a high pressure in the left atrium, it will then cause high pressure in the pulmonary artery. It's like a traffic jam that builds backwards and backwards and backwards, you know. So the pressure is higher in the pulmonary artery. Then the pressure is transmitted back to the right ventricle. Okay, the right ventricle cannot pump blood well into the pulmonary circulation because because of pulmonary hypertension. So when the right ventricle cannot pump blood, it will also push pressure back into the right atrium. The right atrium will be high pressure also. Then the right atrium will push back the pressure into the JVP, so it will be elevated. Then it will also push back the pressure down to the IVC, inferior vena cava, and cause the liver to be distended, hepatomegaly, and the pressure goes into the abdomen causing ascites. The pressure goes down to the legs and it causes edema. Okay.
All right, thank you, Prof.
Okay, any more questions?
Prof,
Yeah.
uh,
I want to ask something. Sorry. I'll ask before. Okay. So for aortic stenosis, so the ventricles will be dilated and hypertrophied. However, will the mitral valve also get
the left
will the
ventricle will be dilated and
the left
hypertrophied.
ventricle? Yeah.
Yes,
So, but during pumping, would it cause a strain to the mitral valve?
it will but it will not damage
Will it
the
strain the
mitral valve.
mitral then?
No, it
Oh,
will
okay.
not. The mitral valve is very, very strong. It's a very good valve actually. If it's not damaged, it will do its function to protect the rest of the heart.
Uh-huh. So the same thing happens. The left atrium is not affected, lah.
Yes, yes.
Thank you very much, doctor.
Okay. Unless you have damaged aortic valve and also mitral valve, then you have a lot of problem. But if the mitral valve is not damaged, it will protect the rest of the heart. Okay. Only the left ventricle is damaged. It's
Thank
hypertrophy.
you, doctor.
Okay.
Well,
Yes.
for mitral valve, there's a difference between the mitral regurgitation and mitral stenosis that the LV is not damaged, right? But then how about the
Yes.
difference? How about the difference between aortic regurgitation and aortic stenosis?
So in aortic stenosis and regurgitation, the only chamber of the heart that is damaged is left ventricle. So it's the same whether you have aortic stenosis or regurgitation. Okay, the hemodynamic consequence is the same.
So the only difference is the difference in the valve itself, whether it's narrowed or if there's regurgitation.
Yes, yes, you're right.
All right, thank you, Prof.
Okay. Okay, just for fun, I would like to tell you there is a condition or an illness called Marfan syndrome, Marfan. In people who are born with Marfan syndrome, they have a connective tissue problem. Okay, their connective tissue is weak and is elastic, super elastic. Okay, they will have weakness over the wall of the aorta, and this condition predisposes to aortic regurgitation. Okay, so if you are asked what can be the cause of aortic regurgitation, the answer can be Marfan syndrome. Okay, you can Google up what is Marfan syndrome. Okay. Okay, in another condition, some people are born with only two aortic valves. We call this condition bicuspid aortic valve. Okay. In patients who have bicuspid aortic valve, when they grow up, because they only have two valves, they will have aortic regurgitation. So this is also one of the causes of aortic regurgitation. Okay. Okay. Any other questions? So for valvular heart disease, uh, the significance of this topic is that number one, valvular heart disease causes hemodynamic consequences to the heart. Okay, hemodynamic consequences, and hemodynamic consequences is because there is back pressure, yeah, reverse pressure, and because of this, the high reverse pressure will cause damage to the chambers of the heart. That's number one significance. This is the cause of heart failure in valvular heart disease patient. Yeah. Number two, the significance of valvular heart disease is it causes turbulence of blood in the heart. Okay, but blood goes in all different directions. Okay, so because of this turbulence, it can cause a clinical sign, and this sign is called cardiac murmur. M-U-R murmur. Okay, what does it sound like? Please search in the YouTube and you can listen and enjoy the visual explanation. You have a nice time. So for your clinical, you need to know cardiac murmurs. Okay, which murmur happen in which valvular heart disease. Okay, what murmur happens in mitral regurgitation, what murmur happens in mitral stenosis, what murmur happens in aortic regurgitation. All these are very important for you to know and for you to master the skills right through postgraduate. Okay, it is important examination skill to be able to detect and identify murmurs. Okay. Number three, what is important? Because there is turbulence of blood in the valve or over the valve, you can have infective endocarditis. Okay, and this is what you need to prevent and treat in the clinical situation. Yeah, as doctors in the future, you need to identify valvular heart disease because you need to tell the patient that they need to be on antibiotics when they have a procedure done or when they deliver a baby, when they have a small cut on their skin, they need to have antibiotic prophylaxis. Okay, so that they don't develop infective endocarditis. Okay, number four, the significance of this topic is there is a condition which causes people who take drugs intravenously, they will inject skin commensals in the form of bacteria, most commonly Staphylococcus aureus, and these bacteria that they inject along with their drugs can land up in their heart and cause tricuspid regurgitation, primarily caused by infective endocarditis on a normal tricuspid valve. Okay, the valve is normal, but because they inject a lot of bacteria, the bacteria can infect and damage a normal valve. Okay, and it is specifically for tricuspid valve. No, usually not does not involve valves on the left side of the heart. Okay, last question before we take a break.
Prof,
Yes,
should I send the attendance?
please give it to Dr. Liana.
Alright.
Okay, so let's take a break while I organize reorganize my computer. Inshallah, we will restart at. Is it okay to restart at 10:20?
You can.
Yes.
Okay, okay, right. So if we restart back early, we can finish the session today early also. Okay. So I will leave now and I will rejoin at 10:20. Okay. Thank you very much. Bye.
The attendance is in the chat now, guys.